Hello people, you're welcome to Dr. Buchi on Purpose YouTube channel. If you're new on my channel, thank you for stopping by. You're welcome. If you're an old or a returning viewer, you're most welcome. Please do try to hit the subscribe button. Today we'll be talking about platelets. And as we all know, in the bone marrow, white blood cells, red blood cells, and platelets are all produced in their relative measures. Now, the big question is, what is platelet actually? The tiny fragments or pieces of fragments without nucleus that do lack nucleus found in the blood, which aid in wound healing, formation of clots, as well as help to stop and prevent bleeding, are known as platelets. Platelets are colorless. They are small. They are disc or plate shaped in their non-reactive forms and are present in both the spleen and the blood. Naturally, platelets circulate through the blood, but as soon as they recognize damage on the blood vessel, the blood vessels give out signals and then make them bind together. They respond to these signals by migrating to the sites, what I mean is damaged sites in quotes, and then transform to platelet active formation. Thus, they develop long tentacles in order to reach or make contact with the affected blood vessels. Platelets function in thrombosis, platelets function in hemostasis, and platelets also function in wound healing. Platelets are known as thrombocytes. An increase in concentration, contrary to the normal range, is known as thrombocytosis, and a decrease in concentration lower than normal is called thrombocytopenia. The bone marrow houses stem cells that develop into red blood cells, white blood cells, and platelets. But since we are dealing with just platelets today, we would rather put away red blood cells and white blood cells and concentrate basically on just platelets. Platelets have the lifespan of about 8 to 10 days, but some persons would say 8 to 12 days as well. Another big question is, what are some of these diseases that kill or rather bring about thrombocytopenia and a reduction in concentration of platelets? In some occasions, the immune system mistakenly attack or destroy platelets. This condition is known as immune thrombocytopenia, which can be triggered by HIV, hepatitis, or even H. pylori. Of course, you know that H. pylori is a bacteria that causes stomach ulcer. Immune thrombocytopenia, which is ITP, leads to excessive bleeding caused by abnormal low concentrations of platelets. Signs of ITP include superficial bleeding into the skin, gum, and nose bleeding, blood appearances in stool or urine, abnormal heavy menstrual flow. Complications that come with ITP is ICH, which is intracranial hemorrhage, but this is rare though. Now let's look at it this other way. Thrombocytopenia can result from bone marrow disorder like leukemia or even an effect arising from some medications. It is a case that affects both children as well as adults. Signs of thrombocytopenia are fatigue, splenomegaly, nose and gum bleeding, prolonged bleeding from cuts, heavy menstrual flow, purpura. When there is less than 150,000 platelets per microliter of circulating blood, thrombocytopenia ensues. The body frequently generates new platelets, but platelets live for about 10 days or, as the case may be, 12 days. Thrombocytopenia is rarely inherited. Therefore, platelets can be reduced in number by so many cases, such as destruction of platelets, reduction in the production of platelets, or the trapping of platelets in the spleen, which is a little organ in the rib cage around the left side of the abdomen. When the spleen is enlarged, it can house a lot of platelets, and this can cause shortage of platelets in the circulation, leading to decrease in the number of concentration of platelets in circulation. Different factors like certain anemia, leukemia, and other cancers, viral infections like hepatitis or HIV, much alcohol intake, pregnancies, bacteria in blood, hemolytic uremic syndrome, even radiation therapy, chemotherapy drugs, yes, and so on, can reduce the production of platelets, as you say. When the body generates more platelets than normal, it is known as thrombocytosis, and when the reason or cause is an underlying case, we refer it to be either reactive or secondary cytosis. But if it is otherwise, it is referred to as primary or essential thrombocythemia, which is a disorder of the bone marrow and of the blood as well. In order to manage a patient whose test result interprets thrombocytosis, it is pertinent to also establish if the thrombotic situation is either reactive thrombosis or the case of essential thrombocythemia. Patients with thrombocytosis do not present signs as well as symptoms often, but patients with essential thrombocythemia can, in some cases, have signs and symptoms linked to clots as well as bleeding. The signs and symptoms could range from headache, numbness of feet and hand, or even both, weakness, pain around the chest area, and so on. Reactive thrombocytosis can be caused by a series of health challenges like iron deficiency, spleen removal, infection, cancer, bleeding or loss of blood, hemolytic anemia. Here in hemolytic anemia, the patient's body destroys red blood cells faster than normal. Inflammatory disorder like rheumatoid arthritis, sarcoidosis can also bring about thrombocytosis. Surgery is also not left out, and so on. The cause of essential thrombocythemia is believed to be linked to mutation. If you're out there living with thrombocytosis, please, I would suggest that you connect with disorder support groups. There are so many disorder support groups around the globe. You can connect to them for help. In adults, normal platelet counts ranges from, they range differently. There will be a separate video for platelet measure. In the bone marrow, platelets are generated, and this is done by the megakaryocytes. The entire process is regulated by thrombopoietin, TPO, thrombopoietin, which is secreted by the liver into the circulation. Do you know that complications such as stroke, heart attack, or even blood vessel cuts can arise from too many platelets in the circulation? To cut down or lower platelets, some doctors would prescribe drugs in form of hydra, which is also known as hydroxyurea. Since there is basically no cure for essential thrombocythemia, treatments that help to decrease the risk of possible complications can aid in the control of symptoms if present. Women are likely diagnosed with essential thrombocythemia compared to men. And among the populace, what I mean is among the world populace, there are less than 2 in 200,000 individuals diagnosed with essential thrombocythemia annually. It has been recorded that stressful life activities or even anxiety can lead to high concentrations of platelets. You know what? Platelets are not even meant to be called cells, but pieces. They do not have nucleus and they do not have the ability to divide. They are pieces of the membrane of megakaryocytes and little part of its cytoplasm. On bone marrow biopsy, platelets are invisible. What you see are their parents, which are then the megakaryocytes. For platelets visibility, you need a blood smear, or what we call the blood film. What stimulates platelet production? This is another big question. I would need to recap again, as I have explained a little earlier. Now, there is a hormone called the thrombopoietin, and just as in the case of erythropoietin, EPO, that help to stimulate the production of red blood cells, same thing happens here in thrombopoietin, which is sensitized by the liver. And this is the basic reason why in liver diseases, or liver disease rather, maybe a severe liver disease case, there is thrombocytopenia. Reason being that now we have decreased thrombopoietin. In the cases of inflammation or malignancies, there is increase in interleukin 6. There is increase in thrombopoietin, and there is increase in platelet count. We could connect to secondary thrombosis here. We can recall the primary thrombocytosis. Can we recall the primary thrombocytosis now? If you can remember, I mentioned earlier, it is essential thrombosis. One of the myeloproliferative disorder combined with multiple myeloma. Reduced concentration of platelets can stimulate thrombopoietin production to increase platelets back to normal. This is the one we call negative feedback. The splenic macrophages are responsible for the removal of platelets, while the megakaryocytes in the bone marrow are responsible for the regeneration of platelets. Finally, I don't refer platelets as cells because they cannot divide. Until we connect again on this channel, I would like you to stay woke and ensure that you subscribe to my YouTube channel. I would like to appreciate everyone, all the wonderful people who support this channel on regular basis. Once again, I would like to say thank you to you, Rosemary Okpekpe TV, for your support and love for this channel. Thank you so much. Catch ya.
Hello viewers, you're welcome to Dr. Buchi and Purpose channel. Here I create comprehensive, easy to grasp lectures for students and non-students. My lectures are detailed and easy to assimilate. I also share useful academic information, career, job opportunity tips, lifestyle, and health talk. If there are topics you want to be discussed here, please do well to mention on regular basis.